Namaste everyone. I welcome you all to this Gurubodha session number 9. We have with us Dr. M.B. Gururaja sir today, and he is my Ayurveda teacher when I was doing BAMS, and his guidance has been phenomenal throughout my student life and also career. So on behalf of all of you, I welcome Dr. M.B. Gururaja sir to this function.
Thank you, Dr. Janardhan.
Dr. M.B. Gururaja sir is an Ayurveda professor and also a practitioner with more than 21 years of experience. He practices in Dhavala Pentacare Ayurveda Treatment Center, Shivamogga, Karnataka, India. First question is related to Ramakrishna Paramahamsa, one of the greatest philosopher and spiritual person. And the question is, what is the role of bhava or feelings in preparation of medicines? Suppose a physician is preparing his own medicine for his students. What is the role of feeling or positive vibe or positive feelings that he's going to act? This looks a little bit, for Indian context, it doesn't look a proper question, but in countries like Europe and US, where Ayurveda is bursting into the scene and getting popular day by day, this is a valid question there. The bhava or the feelings of the person who is manufacturing, does it affect the action of the drug if the Vaidya is motivated by profit rather than welfare of the patient? To give a little bit of context, Sri Ramakrishna Paramahamsa ji, he was very particular about this, meaning that somebody comes to him with the intention of greed or negative feelings, he would sense that very quickly. And he was very particular about his diet. He was like probably one of the highest spiritual persons in the world, and he was very particular to cook his own foods. So he was saying that whoever cooks the foods or whoever prepares the medicine, in our example, they will have their own feelings imbibed into the medicines. Of course, in today's scenario, when we are relying morely on the pharmaceutical company products, it doesn't make much sense to think in that way. But at least the profit part and the feeling that the Vaidya has towards his patients, whether it's really positive or the Vaidya is money-minded or Vaidya is not really knowing what he's doing, but somehow trying to get some sort of treatment without proper knowledge, all those things. So will it affect the patient's outcome in the disease treatment, Dr. Gururaja sir?
No, definitely. Bhava has a important role to play. We need to understand why this concept has evolved. The mere reason is, whenever we are doing certain preparations or cooking certain material, we should give utmost concentration and we should be very much concentrated towards what we are doing. For that purpose, we need to be. See, that's the reason nowadays also we have got a lot of GMP, good manufacturing practices, and there are so many personal hygienes and hand hygiene and everything. We need to maintain so many things in the manufacturing area. Along with that, if the one who is involved in the manufacturing, if he is being trained or told in such a way that whatever you are preparing is one of the best quality medicine, you need to have to concentrate on this, and people who are going to use this for their saving their lives, and it is a life-saving material, so you should have at least a courtesy so that you should feel great that you are involved in act. So these type of motivational things definitely will boost the workers who are working in the pharmacy and production area, definitely. And along with that, to give an importance to that, if we if it is such type of manufacturing areas are provided with some audio clippings and continuously behind some mantra uchara or some ghosha is continuously going or some positive vibrations are created, definitely it has an importance, a role in the play on the particularly the manufactured drug. So definitely we have that type of intuitions that something which is done in the presence of holiness and under the holy feet of somebody and in the presence of some elders and some on auspicious day on a particular note, definitely it is going to have positive vibrations, and definitely these positive vibrations definitely do have its role in maintaining the health of a person. So I do suggest that that type of positive vibration should be created at the place where the production is taking place. Next part of it, what do you call profit making and all those things. Of course, Vaidya is also a human being. He also has to supposed to live in this materialistic world. So he should not become a greedy, but for his livelihood, whatever it is to be there, that Dhanvantri Bhaga, Rudra Bhaga, that portion has to be taken care by the Vaidya for his survival. And that is the reason these things are very much incorporated into the Indian practices in Ayurveda, that Dhanvantri Bhaga and Rudra Bhaga, these that when a patient comes to a Vaidya for a particular thing, and the Vaidya will ask the person to bring so many drugs and even the Gruta or something like that, then he used to prepare the medicine, and some portion of the prepared medicine is to kept by the doctor, and remaining thing will be given back to the patient. So that is, he will going to utilize it for some other patient or for a poor patient, something like that. So this concept was developed in the very long back, that is for the survival of everybody. Of course, Vaidya should not be greedy. If he is a greedy, definitely he will not be doing the service. If Vaidya is always, whatever his activity is there, it is be some service oriented and supported by at least minimal charity. So whenever there is a poor patient, we need to always go for a reduction in the concession, the fees, as well as even sometimes total abolishing the fees or just giving the free of things. Sometimes some physician samples are being given to them. So all these things are quite obvious that it should be done. It is, see, all these are attached even once again with the concept of karma. This whole deed and dharma and karma, whatever is done, definitely going to help the physician as well as his future generation.
Interesting that you bring about the point regarding the karma. There is an Ayurveda school in Netherlands, and there is this Vaidya Kun. He is the principal of the Ayurveda Institute, and he runs the institute and all. He always says that, this Ayurveda, not only in the Netherlands or Europe, even in US and all, as of now, it is not making sufficient money as in other industries. But he said that it's surely a way of like burning out our past karmas, and it is a Ayurveda practice and Ayurveda teaching both are a way of like burning out our karma and internal cleansing also.
No, it's okay. But see, when we look at the different perspectives, then we miss so many things. But the reality is that everybody wants money to survive in this materialistic world, and even including the Vaidya. So even he has to feed his family and his dependents. So that is not a right thing to say that Vaidya should not take money. Of course, he should not become greedy. He should have some balanced approach towards life. If that is there, then it is definitely it's going to be helpful, even for his next generation as well as him for to maintain the dharma, all those four pillars he has to maintain. That part should be taken care of.
And also in the context of herb collection, Dravya Sangrahana and Samrakshana, with Sumana, one should go with Sumana, it's told. Like one should go with positive spiritual kind of mind. Shweta Vastra Dharana, it is told. One should wear white dress, and the herb collection should be done on an auspicious day and at the auspicious moment with the right stars and constellations. So in this way, the manufacturing is very well blended with the good vibes or the positive and spiritual vibes.
Definitely, that type of things, the collecting the herbs from a very good area, from a right direction, that is from the northern direction or eastern direction, from the place where you are staying, and trying to get it from on a holy day and a particular constellation, and all those things. These are all a part of bringing a sanctity towards the work. And if such sanctity is tagged, definitely we feel somewhat sacred, and we do the things with a justice. Otherwise, sometimes there may be chances of taking away, just violating the norms and going away from deviating from the normalcy, or what is expected out of us in that situation. So in order to make ourselves compulsory and mandatory that we should adhere to these norms and all those things, probably our acharyas, our elders have kept these type of things. Definitely it is going to help the manufacturing area and make it a clean one, Definitely, this is a very important thing to be taken care of while drug manufacturing. Collecting from a very good place, collecting from a very good direction, and doing it on a particular holy day and auspicious day, and wearing a white cloth and all this is it's only symbolism of white cloth and all those things. It means you should be having personal cleanliness. So then that will definitely going to help us in maintaining good quality of product. That's the reason.
But in the Western countries, I have seen that the blending of spirituality with the Ayurveda medicine preparation, they sometimes go overboard. I mean, they will advertise it as this particular mantra has been chanted while manufacturing this particular product. Because Ayurveda is again blended with spirituality, some practitioners market it as this will stimulate the kundali, and this will imbibe the positive energy. But marketing and spirituality, they usually do not go hand in hand, right, sir?
No, that is altogether a different area of big research. We need to just observe the medicine prepared without such type of mantra gosha and all those things, and then with the mantra gosha and this is two different batches has to be prepared with all keeping the things in standard parameters. Then we may study that its efficacy on the patients. Then in a larger setup, when you do this research, then we can say that there's something this type of thing will help the patient in a larger way. Otherwise, it is for the benefit of in Ayurveda there is one area, it's called as Sattva Vajaya Chikitsa. To enhance the sattva of a person, we need to enlighten certain areas of concepts or something which is related, components related with the manas, like sankalpa, dhyeya, acharane, vichara, all these things. So these type of things should be stimulated in such a way that so it gives out a positive vibration and the person starts feeling it in a nice way. But big question mark is whether the person is optimistic or astika or nastika or naysayer. No, it cannot be. The one who is totally non-believer in all these things, how can you make them to believe this? Then he will say all these things are nothing. So it is entirely depend on the person, one who takes it, or one who takes your services, one who takes these things.
And coming to the focus and concentration, I have seen for those people who do not know. I mean, my mother was treated for diabetes with Dr. Gurubodha sir himself. So I have seen that you have kind of a one point focus, or like you are like well balanced and very calm and listening and speaking only at the right time, all those things. Is there any like premeditated steps that you follow when you are in a clinic?
No, I usually it is not the criteria that doctor is, because many times the patient who comes to us will always have a lot of things to say. They wanted to speak out their feelings and their problems to, and they want to share their things. But when many of the times when we are busy practitioners, we don't give much time for them to explain their criteria and their problems. Maybe what they are highlighting may not be a bigger one, but for them it is a very big issue. But when we give a silent hearing to those type of things, definitely patient feels comfortable. We can hear to those information, definitely we can suggest accordingly. And there is no premeditated or whatever the line of treatment or whatever it is always a customized one. When a patient comes to us, we will listen to him and we will understand him. Then all the darshana, sparshana, prashna pariksha is over. Then comes the whatever the suggestions may be, that we will take it at the later end.
Yeah, Vaidya Deepthi Singh from Chicago writes, I think people must know about the spiritual element involved into the therapies and preparation works of the dravyas or herbs or medicines. I do not think removing spiritual aspect of Sanatana Dharma from Ayurveda is right. So even we have seen some people marketing just yoga as just kind of a breathing exercise or a stretching exercise itself. But it is imbibed and it comes from the deepest of the corners of our Sanatana Dharma or the Hinduism, sir.
So definitely, see, it's not a bad idea of promoting it, but to who will take it, that depends on him. The service, whatever we are going to provide, definitely somebody will be there who is a taker or a seeker, a buyer. The one who buys it, who should believe in all these things. If you are selling these things that you are prepared a medicine with the chanting of Vishnu Sahasranama or something like that, and you want to promote it in religious places like or the countries like where there is no Hindus or non-believers, there are different set of people, their religion would be something different, something as a different god. Then to him, in front of them, if you say this is a very good one, that is not a right kind of promotion always. So whatever it is there, those patients, if they are interested in that or they believe in those things, see, all these factors we will come to know only when we discuss about the patient history taking. When we are taking the history, the lot of information will be given by the patient. So based on that, their name, their caste or religion, their food habits, their culture and their behavior and all, when these type of matters are collected, information is collected, then accordingly we can plan out what should be suggested to him, which is most relevant. I don't want to translate anybody from one caste to or one other one or some religion to another religion or their customs, and I don't want to change their things. Simply without harming their beliefs, what best can be adopted or what best can be given, that is the intention of practice, should be from a Vaidya.
So this is a case study which was previously posted. A person in his 40s, blood spitting from mouth early in the morning. He had long history of acid reflux, and it was just a bit of blood in the saliva when he spat before or after brushing. He has been doing various tests, only found inflammation in the gut. He was given antacids and for few years, and yet the blood in the morning is a common phenomenon, a daily event. Last 6 months, he is on the diet and herbs such as gas gourd, avipattikara churna, trifala, etc. And his recent test shows gut inflammation. He feels energetic, he's not bloated, he feels hungry, but still blood is coming through the mouth early in the morning. How to approach, and what are the different ways we have to look into here in this case, sir?
See, first of all, we need to understand the main complaint of the patient here is bleeding. So we need to observe these, whether it is a clotted blood, what is suggesting, or it is a fresh blood. If it is a fresh blood, then definitely we should go for the color of the blood. Fresh blood color is very much reddish and very clear, then it is a bleeding from the oral cavity or buccal mucosa or somewhere, or from the gums or something like that. It is not from the stomach. If it is from the stomach, definitely due to the presence of acid over there mixes with the blood, hematocrit is formed and it becomes a coffee brown color. It won't be a reddish color. So such differentiation we should be able to make it to assess whether this bleeding is from the gut or whether it is bleeding from the mouth. So first we need to understand. And you observe here in this case, the bleeding is soon after brushing. Maybe there is a wrong way of brushing, is rubbing or vigorously over the gums, maybe inducing in bleeding, capillary bleeding, maybe from the bleeding from the gum, it may be spongy gums. So we need to understand all these aspects. Simply from the gut, if the bleeding occurs, then it won't be a fresh blood and it won't be of a reddish color. That we should understand. Of course, a person who is having acidity or hyperacidity or these type of sore erectations and burning sensation, and there is a gut inflammation and all those things, like definitely that stomach guard or whatever that they are giving and containing avipattikara and all those things, definitely they'll do pitta shamana, and the excess pitta, if it is there, then it will be thrown out of the system as some regular bowel cleansing. So definitely it will going to help it. But we need to understand whether that bleeding is from the gums or buccal mucosa, or it is from the stomach. If it is from the stomach, the color will not be fresh reddish, it will be coffee brown. So that differentiation we should know that.
Vaidya Singh says, does the person floss? Usually people who do not do the flossing get gingivitis. Just a thought. Even from an Ayurveda perspective, to diagnose this, can the bleeding from gums can also be considered as a form of Urdhva Raktapitta itself?
No, that can be considered. If it is, then we need to understand many things. If there is an injury, then bleeding is there, then we should not consider this as a Raktapitta. Raktapitta is when Dravatva of Pitta is increased, which in turn has increased the volume of blood, and thereby it is oozing out without causing any physical injury done by us from our side. So it is a spontaneous bleeding, then we can take it as Raktapitta. But after brushing, if bleeding occurs, then it is not a spontaneous one, it is due to the wrong way of brushing. We need to understand that.
And thank you for your valuable inputs there, sir. The next question that we have is that, again, it is related to money. I have been accused of being money-minded because I charge as per the hour basis, like half an hour, so and so rupees, and whatnot. Even in the modern Western medicine or the MBBS, there also it is becoming like a raging issue that should the fees be low or should the fees be high? How to go about it and all. So, patients will think that, just because writing a prescription or just analyzing in the mind and writing prescription might not require that much of a fee. So, how to address this issue, sir?
No, that's what I said. It's very clearly the way we live. Everybody feels that a doctor makes a lot of money, but nobody observes or understands the pain he has taken for that to reach that condition. People who get a free seat comparatively in a government colleges and they go for the MBBS or BMS or what it is, they make a degree with comparatively less expenditure when compared to a person who has taken the seat on a payment. And after completion, when he comes out, nobody gives him a land or a place feeling that he is a doctor, he is going to serve the society, so he should be given free of cost. No, they at the commercial rate. When we want to construct a building for the purpose of hospital, then also the municipality or the district council or whatever it may be, the corporation, they charge us in a commercial way. Commercial licensing fees, commercial water connection fees, commercial electricity fees, and everything commercial. It is not domestic. So when a doctor has to pay all these things at the commercial rate, he has to survive, and ultimately you expect that he should do a charity and service. This is not a right kind of expectation from the society. Society should understand that a doctor also is just like another human being. Even he too has his own family to feed on and his requirements to be taken care of. And to become a doctor, he has burned a lot of midnight oil and he has taken a lot of pain. So once he has reached that stage, definitely we have been certain due respect to his services.
Yeah, we were discussing this with one pharmacological scientist, and he said a story about this. It's an interesting story. That a machine was not working properly, so they brought in an expert from a different country, and what he did was, like, for 5 minutes he was looking into the machine from all angles, then took a hammer, he ran the hammer and he beat the machine in one particular way, so it got all right. So then the machine owner asks, how much is the charge? So he said that my fees for this is like $10,000. So $10,000 is like 7.5 lakh rupees. So everybody was stunned that, just for running a hammer, he's asking so much of money. Then the owner asked to give the breakout of why the charge is like $10,000. For that, he said, for running the hammer or hitting the machine with the hammer, $1. And to know where to hit the hammer, there is this $9,999. So that was his breakout given. I am into Ayurveda article writing. They'll think that, just it is writing, or just give it like 300 words, 500 article for us. And they'll never come to the fees aspect, because, we have to value our own time. So the knowledge where to hit the hammer, or the knowledge of a Vaidya, how to approach which disease, all those things are like highly complicated and they have their own value also, sir.
No, definitely, that's the reason. See, he might have a lot of time he has utilized on those areas to understand the conditions of various body natures, diseases, manage this. And whenever patient comes to us, we will be in a pain. So in that situation, we need to bring back that patient out of that dangerous area. And to do all these things, he has its own capabilities and understandings. And while doing all these type of things, definitely he has to charge. And it is a survival. And we need to understand that this is a part and parcel of any services which is usually offered. Definitely all services should go with some price tag. So there will be price. We should not feel that it is not a right kind of pricing or something like that. Of course, there are some exaggerations are there. That is also a part of it. So that's the reason in Karnataka we have now under KPME there is everything has to be fixed. All our prices and has to be displayed, and even everybody has to write down their pricings and display it, and it is a mandatory.
But I feel that we were discussing that the consultation fees has to be fixed and it should be displayed. I feel that is little bit unfair to the Ayurveda doctor, because with some clients, some patients, we need only like 10 to 20 minutes to come up with the diagnosis and to write the prescription and to dispense and all those things. But in some clients, we need like 1 hour. So I mean, if somebody asks me, of course, nobody is going to ask me. I would say that it should be based on the number of minutes or number of hours spent.
See, it's very clear. Nowhere government or anywhere nobody has said that you should fix the fees. Only you have to display the fees. They have said whatever the fees has to be fixed, it is by you. You can go with the autometer or something like that. You want to continuously run, and when you are using it and you have to pay, that is entirely different thing. That depends on the person to person and the doctor to doctor. So it is your discretion to how much you should take for your consultation. You may charge 1 rupee. You may charge $10,000. It is up to you, and it is for the paying capacity of the client. So it's not a big issue. But government never says you should only fix this much. Only for certain things they have made mandatory. This particular amount has been fixed for example, certain operations and certain implants or something like that. It's not for the consultation. Consultation, they say that you need to fix the consultation and display it. That's all. You fix it by yourself, whatever you want to fix it.
Moving on to the next topic that we have, incorporation of a little bit of spiritual or a little bit of dinacharya into the mix, especially for the children. So now the world has become so fast that parents, though they want their children to be following a disciplined lifestyle and all, they will not be in a position to like train their children with say basics of pranayama or omkara chanting or bhajan or all these things. I myself have started suggesting, at least to those parents who are at least willing to listen to me, that they have to wake up their children at early in the morning, and then they have to take their food only after taking bath. So I'm not saying that these have been getting pushed into the patient, but wherever applicable, I am just trying to push these things so that the discipline that our elders, our parents, our grandparents who are following, at least some of that comes back into the today's daily lifestyle.
No, that has to be done. Like it is some part of Sattva Vajaya Chikitsa also. Mani Mantra, all those things also do have its own importance. But many times it so happens that we cannot just straight away push it, because that depends on the faith of the person and his beliefs and non-beliefs. Whether he is a believer in the God, definitely, then otherwise, if he is not a person who doesn't know about these things and existence, and he is somewhat in a naysayer, you can say. So in that person, you cannot say that simply you go for Omkara Mantra cha and even for listening to Vishnu Sahasranama or saying some Mahamrityunjaya Japa and do all these things. That may not be doing it. So it entirely depends on the mentality of the patient and their sattva. We need to understand. Then accordingly, we need to where they'll feel some sort of console. So that should be there. And we need to concentrate on those parts. And regarding the training the children, young generation, always the young brain is very good in absorbing the things, and they will imbibe these things very fast. And we need to understand, and we need to develop these type of things in particularly for the younger generation, so that they'll go for the yoga, pranayama, omkara, and all these type of things, breathing exercises, and so many things. So this will be a very good idea of incorporating these concepts into their young brains, and so that they'll practice in future. Definitely, it's creating very good human beings. So these people with these type of background and training definitely lead a healthy life, and they become asset to the society. That's the reason that all these areas has to be made strengthened.
And especially with the children with a concentration problem, or they're not studying, or they're not getting good grades, parents come worried with all those things. There especially some techniques to keep the smartphone away at least for a specific amount of time, including that discipline into their lives helps them to enjoy the benefits of having a disciplined lifestyle. So,
the young brains, the children, they'll be very good observers. They'll be observing their surroundings. They're also observing their parents. So whatever we are doing at home, they'll be following and simply copying it. So we need to be very careful what the way we are living and what we are doing it. That is the most important thing. Many times even I train to my patients, those who are come with the young children with their complaint. I ask them, see, this is what you are supposed to do it. You do the things in a right way, then they will copy it. So it is up to you to these things. Once you start doing pranayama in the morning and yoga or walking or something like that, then automatically they also start doing it. So they will have a impression that that is good. My father is doing, my mother is doing, let me do it. So that's the way we need to bring in the importance of these type of concepts into the young brains, so that they will be following it in future.
and there is this again a raging debate in the Western world that some Ayurveda doctors come with generations together of their experience. And their father, their grandparents were Ayurveda doctors, and father was there. Now he is there. Ayurveda experience, and there are some people like I myself who do not have like an Ayurveda background. They use this as a kind of a marketing tactic that my spiritual guru has taught this particular Ayurveda technique to me, so it is unique to me only, and it is like nowhere seen. So whereas on the other side, we are there academically trained with 5.5 years of BAMS, and then 3 years of MD, and so on and so forth. The market is open for both, and how to see this, sir?
See, first of all, previously in India, the education of Ayurveda was not so regularized. So then came the CCIM. Then now it is replaced by National Commission for Indian System of Medicine, National Council for Indian System of Medicine. Entire activity now totally under the control of these things, these councils, and they'll prescribe the minimum standard regulations, what should be there and what should be, how it should be trained, or all those things. So if nowadays, if your degree is to be taken, then we need to go for that. That is a valid degree. And when we are trained in a particular college and taught in a college and this academically, that is the one which is accepted by the legal fraternity. Followed by a spiritual guru, and I was told by him, and I am a traditional Vaidya. That concept is almost outdating. Those who are present, that will be their last generation doing it. Once they are gone, there will be no further things. You cannot have a new person now and coming and saying that I am a traditional Vaidya. No, it cannot be. That is been regulatory ban is there provided. So one cannot become a Vaidya in that nature. He has to come through the professional, official way of training and teaching, and through that only he has to get developed into the come to the mainstream of Ayurveda or whatever medical science or whatever it is. So any regulation, doctor courses in India or maybe throughout the world now it is regularized. So there is no question of something which is traditionally some person is practicing. Maybe he is practicing since so many days. That will be end for him. And once he is gone out of this world, then there is nobody to keep his tradition in such way. But only his techniques and his information, his knowledge, if he is able to give it to the next generation, that can be carried on. So that doesn't mean that that should not be taken care of. That can be taken care of. But the difference between the two, because my spiritual guru has trained me in such a way that I have a spiritual power, and I don't believe in those things. Skills are developed by the individual. A guru can only train and teach and things, but it can be mastered by the individual, he himself. So he has to train himself, or he has to train in such a way that he imbibes those skills of understanding a condition. Then comes the real result out of it. Of course, to achieve a result, not only simply a doctor or a Vaidya can bring a result. All the four factors, four pillars of Chikitsa Pada, all should be in a very real sense. Doctor, patient, nurse, as well as the drug, all should have possess the required qualities, and they all should come in line, and then only results will be. You may be a very good doctor, you may be a very good person who identify the disease, maybe have a very good setup of paraphernalia, you may have a prescribed a very good drug for the condition. If patient doesn't take it, then result will not be there. So it is supposed to be taken by care by all of them. If all the four pillars come together and fall in line, then only we can have a result. So totally, it is absurd saying that my spiritual guru has taught me, that's why I am superior, and somebody who has trained in a college and is inferior. No, it is not like that. Anybody who has imbibed the skills and knows the knowledge definitely is good.
Moving on to next topic, we discussed in one of the previous classes that you would not entertain a client who says that the proprietary medicines should not be prescribed and traditional medicine should be prescribed. You would not entertain it. But if someone is vegetarian and if he declines the non-vegetarian ingredient medicine, do you oblige there?
Definitely, because consuming food or a medicine, of course, it is a domain of the patient. But when any patient insists on proprietary medicine or classical medicine, then I say it is not your domain. It is my domain that I should decide what should be best for him. But his faith is involved. That, for example, he is a Hindu Brahmin. He doesn't eat a non-vegetarian thing, and he don't want to consume the capsule because it is made, outer covering is gelatin. Then I cannot push the medicine in the form of a capsule to him and I ask him to prescribe and these things, you have to eat this one. No, I cannot. If he has an objection to that, then definitely I'll oblige. I have come across such many things. For example, few of my Muslim patients, I have gone through this. They say that, sir, it is something, it is there in, I have heard in Ayurveda, something which is done with Gomutra, and that Gomutra preparation is haram for us. Please don't prescribe such things. You can avoid those things. Definitely, I do avoid those things because I don't want to disturb anybody's faith and anybody's beliefs. It is their customs and their beliefs. I don't want to disturb those areas. And similarly, I have got many patients of Jain. They say that we don't want to consume lashun, garlic, we don't want to consume potatoes, and even you don't want to take the honey. So many things they'll tell. And okay, I will just accordingly I will design the prescription what should be given to them. So I cannot simply say that for a person. Definitely, even when medicine like Chagalya Grita or Ajamamsa Rasayana to be prescribed, I will do check my background study of those patients, whether he is a consumer of non-vegetarian or not. I will do check, and then I will also ask him that this contains this particular do contain some non-veg material. Do you have any hesitancy or any objection to this, or are you able to take it? I will clarify and then only I will prescribe. So particularly with these types of customary changes are there, and their faith and beliefs and related to religious aspects, I don't want to disturb, and usually I don't disturb because my intention is not to alter those things. My intention is to clear off the disease.
Is there any guidance on Ayurvedic protocol for hypothyroid patients for stopping allopathic thyroid hormone pills and bringing thyroid into balance or moving to Ayurvedic medicines?
So when somebody is already a hypothyroid patient and external levothyroxine, simply don't, without any background check, don't disturb the things. First you go with when patient is taking the thyroxine, you go for the evaluation of thyroid function test, that is T3, T4 and TSH. Then once the result came out, then you try to understand whether the thing whatever is taking is good or bad, is doing the values, functions are being all maintained or not. So once such things are not achieved, then you go for altering the things or modifying the things. Or when a patient says that I don't want to continue with the allopathic things, I want to shift to Ayurveda, then also precautionally, with all these precautions, step by step, you reduce the amount of levothyroxine, whatever they're taking, and add on with the Ayurvedic anti-thyroid drugs. So slowly, then in a periodical manner, then evaluate for dosage, then compare the values, then adjust the doses, and it is to be individual to individual. We need to adjust the doses, which is not a tailor-made or ready-made some protocol which can be straight away given to any individual. It is to be redesigned and readjusted according to the needs of each and every patient.
Sir, I have a question. This is Dr. Bhavani here. In allopathy, hypo or hyperthyroid patients, they have to say that lifelong they have to be on medications. Suppose they want to shift over to Ayurvedic medications. How do we go about that? Sir, Gugulu preparations, can we give it for so long?
It can be given, but thing is that's what I said. We need to go for a periodical evaluation, blood evaluation for T3, T4, TSH, and accordingly we can readjust, because we have got Kanchanara Gugulu, we have got Varunadi, we have got Gomutra Haritaki, and we have got many proprietary preparations there in the market. We can use it according to the need. So the thing is that we need to adjust with a fine tuning. What dosage we can give it and how long we can give it.
Okay, sir. Thank you so much.
So the point is that it has to be in a gradual, step-by-step manner, right, sir?
Yes, it is. It is to be gradually. You cannot simply suddenly remove support is there, because see, there is a hypothyroidism which is nowadays very common in the society. There are a lot of patients with hypothyroidism, and this hypothyroidism already the doctor has prescribed something oral hypoglycemic, maybe in the form of Eltraxin or Thyronorm or Thyrox or something like that, brand names. With these things, with maybe 50 mcg or even 75 mcg, 120 mcg or 100 mcg, that's a common, and they will be taking it. With this, you go on once again with the checking of this T3, T4, TSH, then analyze external levothyroxine, what is the T3, T4, TSH inside. If it is matching, then step by step by 25 mcg reduce the intake, then increase in those areas with Ayurvedic drugs which is given for thyroid. Slowly, step by step, for over a period of 1 month, 2 months, then once again repeat it, then once again add on, and then reduce another 25 mcg, like that. You need to reduce that in that sense and make the Ayurvedic medicines in a right direction. Whatever you treat, do it particularly. We need to have a continuous medication throughout. That is required, because it's a long-standing thing. One, we need to understand this. If you want to cut short these things, then bringing back the body weight to a normalcy is one of the important criteria. If you achieve that very fast, then the dependency on thyroid things will slowly reduce.
This is like my personal push for the Ayurveda, like BMS student community. So when I finished BMS and I came out, I was not knowing man management, money management, HR, how to treat, say, therapists or workers. Even after MD, also I was little dumb, and I was making a lot of these kind of managerial kind of mistakes. But that was somehow forgiven by the company that I was working, that was AVM. I strongly believe that these type of managerial skills and communication skill, all those things should be incorporated somewhere in the third year or fourth year, so that the Ayurveda doctors are like well equipped. Maybe because national education policy is coming up, probably this one can be included, and even the marketing aspect of it. I mean, how should be the board, how to market, all those things, like total managerial and marketing skills that an Ayurveda doctor lacks. Probably if that is provided in the fourth year, for example, it will, or at least in the internship level, it will further boost the confidence, and that may push BMS graduates to right away get into the Ayurveda practice.
See, that is not the criteria. Those type of skill training and all these things were not there when you studied, isn't it? But still you could able to do it by your own methods and by your own skills and by your own struggle. See, anybody who struggles to achieve definitely will achieve. If everything is spoon fed, then that will not be a thing. Once everything is spoon fed, once again there will be some sort of different level competition will be there once you come out. So that type of course, that should be training of those things, or at least some basic information about these things. Criteria should be explained or explored or even exposed to the Ayurvedic students and their study material. Probably with these intentions only, in nowadays the new norms which have been created, suggesting that there are some subjects which are not from the original Ayurveda subject, but other than those, that is called something optional subject, something like that. They have said three such subjects should be taken on online classes, and they should attend and they should pass it by the end of the year. And there's some credit system they have all developed in even to the next syllabus. Draft is there. So anyhow, that things will be there, but I don't think that doctor should always have these things. See, for example, for marketing and all these things, there are people who are trained in marketing and all those things. We can take the help of them. I don't want to be a marketing manager to promote my product. I should know what to promote. But how to promote, there are people to promote. So let them use their skills, and we'll give our inputs and we can utilize it.
Yes, sir. It stresses upon the willingness of Ayurveda doctor, BMS graduate to, push himself and learn new things and come out into practice rather than somebody pushing him with all the tools. Like you said, there will always be one or the other tools which will be missing, and one or the other skills that the Ayurveda practitioner, the BMS graduate will be missing during his training days.
How to avoid diagnosing in allopathic terms and treating with Ayurvedic medicines? What happens is, the moment we see some symptoms, the tendency is more towards giving it an allopathic diagnosis. So as an Ayurvedic practitioner, how can we correlate, or how can we find the that gap of trying not to diagnose with that allopathic diagnosis and pure Ayurvedic medicine to be given?
See, diagnosis, for the purpose of diagnosis, if you take any tool, there is no harm. It is up to the standpoint where you need to reach. Once you reach there, it may be your diagnosis as in the form of modern medicine terminology, or whether it is in Ayurveda, you need to come to one end. So if you are trying to come to an logical end on this with the help of a modern tool, no issues. You reach there fast, then try to analyze, break it up, that if this is the condition, then where you can place it back or correlate with Ayurvedic terminologies or Ayurvedic perspective. If this particular condition is called in modern as some skin condition or some liver condition, so where shall I put these things with the Ayurvedic terminologies? So when you look at these point of it, then try to correlate. Then accordingly, you will find some clues to match it to exactly where these terminologies of modern can be correlated with the Ayurvedic terminologies. And once you achieve that, definitely accordingly the treatment planning can be done. You should not have that taboo that we should not diagnose through allopathic terminology. That should not be there. Trying to reach to the diagnosis through any means, that is always good. But once you confirm yourself what is there, then shift over from that point to Ayurvedic terminologies and finalize it, what Ayurveda speaks about in this condition, manage it or how to manage it.
Okay, sir. But the knowledge of Ayurveda has to be thorough, so that, because Ayurveda is so vast that the Vata, Pitta, Kapha types also have to be, like for example, fever also can be of Vataja type, Pittaja type. Allopathy has only one, paracetamol. If we have to give Ayurvedic lines, it is very important for us to know exactly all the symptoms and how it is mentioned in our classics, right, sir?
No, that is true. That is true that we should know all these aspects, but it doesn't mean that the Western or the allopathic science is also having a very less information or limited information. No, that is not true. They too have a lot of information, but for them, fever is only a simple symptom. But for Ayurveda, fever is a big disease. So that is the difference between us and their thinking. So when there is a fever, we also try to correlate with associated factors and lakshanas. So once associated things, based on that, we try to analyze which dosha is involved, and accordingly, which are the dhatus involved and what are the manifestation of lakshanas. Once all these things are a chain is achieved, then we come to know exactly the samprapti. Once this samprapti is understood, then accordingly we will go for the breaking of the samprapti. So there are set of standard protocols given by acharyas in whichever the dosha is involved, in whatever the way and in conditions, what to do, what not to do. Accordingly, we should plan it.
Thank you, sir.
What would be the line of treatment for appendicitis in a 21-year-old having grade 1 fatty liver changes?
See, first of all, we need to understand grade 1 fatty liver changes. If you send anybody nowadays, most of them will come with the grade 1 fatty liver changes. That's the reason the British School of Physicians, they are of opinion that no need to treat grade 1 fatty liver, because grade 1 fatty liver is being captured by the very high sensitive probes that we are using nowadays for the ultrasonography. So we need to understand that grade 1 fatty liver is just the alarm for the person. Take care, you are entering in a wrong direction or one way. So please adjust your lifestyle. That is the reason we can say it. Second thing, appendicitis with a 21-year-old, then definitely we need to understand diet. He may be consuming a lot of stuffs from the roadside or unhygienic conditions or chats or something like that, or high rich masalas or stuff things, or even a non-vegetarian material and something like that. So when these type of things are consumed, that may be carrying the infection to the appendix. So we need to go for that. And in time, we need to go for vatanulomana, and we need to go for the slight virechana, and that will reduce the pain as well as the content there. And once those material goes out of the gut area, then patient will definitely feel comfort zone and the pain will be reduced. But still, it is an emergency condition. Many times, it may not be treated easily with Ayurveda medicines. Patient may require some emergency medicines from the other section of the treatment modalities, that is allopathic section.
Do you feel the need to include, for example, neem, turmeric, etc., like anti-inflammatory, antibacterial herbs in that condition, appendicitis?
We can go for even better thing is Sukshma Triphala, where Kajali and Triphala has been combined along with that Rasaparpati, if it is there, and even with the Takrar stands, that type of materials. Definitely we can help in appendicitis condition. But still, many times it is so happens that patient is in a very severe pain, and that needs emergency management, and many times strong painkillers are required, and that there is a lack for that condition. I have to accept that, so that we need to utilize the services from the other side.
Yes, sometimes it can be like life-threatening, especially if it is like very acute appendicitis with very high infection. So we have to draw our own line where we can approach with Ayurveda and we, back off. Sir.
Yeah, definitely. There is a limitation for science. Every science has its limitations. Even Ayurveda has some limitations. So we need to be under limitations. Where to use our medicine or where not to use our medicines. That we should know that.
Thank you all the participants for asking questions and making this more interactive. And thank you, Dr. Gururaja sir, for guiding us and continuing this series.
Thank you.
Thank you, sir.